just wanted to share the presentation that was delivered today in Adelaide at the ANZAHPE conference. The concept of general practice challenges means a lot of things to a lot of people, but for the GPs themselves, the biggest issue, and one that's far from new, is physical and professional isolation. This isolation is what the future GP workforce witnesses throughout their GP placements. So it's what they see in their future self. And that's why we consider the most important support GPSA can offer the GP training community and the community at large is to facilitate connection between and among supervisors, practice managers and other practice team members who are part of scaffolding that learner through their education. Isolation in general practice we consider to have three arms, if you will. There's that physical context, the four-walled consultation room, which is often the beginning and the end of the GP's day with not much in between in terms of outside contact. Then we have the professional context and limited networking opportunities for GPs in their own community of practice, especially as independent GPs are not funded to attend conferences in the same way that specialists attached to hospitals are, is compounded by that historical professional denigration of GPs, which makes interacting with specialists from acute healthcare settings problematic outside perhaps the rural setting where the GP is often working within the acute setting. And then consider the trainees' perceptions of collegiality in the hospital setting and the contrasting aloneness of their GP supervisor in the general practice. This can't be good for attracting more junior doctors to GP training. In terms of overcoming isolation, well, the evidence is clear about the value of communities of practice, but there is actually little in the literature about communities of practice in the GP space, let alone virtual communities of practice for GP training. At GPSA, we've therefore created a research evaluation overlay in our introduction of a virtual community of practice for our members, our 10,000 members, monitoring engagement patterns in order to maximise its utility through co-design with our end users. Intrinsically, we knew we were on the right path with this concept of a virtual community of practice. In the hospital setting, the community of practice is visible, tangible even. So we found a very easy way, really, to give our members visibility over the community they already belong to and let their sense of empowerment through belonging build the community of practice into something they would find rewarding and meaningful for themselves. The GPSA Community Hub is the mobile app for this virtual community of practice we've created, and it was launched for our members with a web interface in April of 2023. Of our 9,640 active members, 1,849 GP supervisors, practice managers, GPs, training practice owners and sector stakeholders have activated their free accounts across this time. Now, that's a conversion rate of roughly 1 in 5. Not bad for a largely tech-phobic cohort. Alongside this virtual community of practice for supervision teams at the coalface of GP training, GPSA has been busy developing solutions to enhance the quality of GP placements, the experience of trainee and educator, the attractiveness of general practice to future GPs, the sustainability of GP training in community and private settings, the quality of training outcomes. The first of these solutions we've come up with, Scenario, was rolled out in time for the GP conferences last year. That was in October when we had an international audience here for the World Wonka Conference in Sydney. GPSA's physical flashcards have been stepped into the digital age as this internationally accessible mobile app designed to streamline education by giving ready access to suitable discussion material for the time-poor GP supervisor. What this app is about was summed up for me by an amazing lady I was sitting next to on the flight here from Melbourne on Sunday. A word that I don't hear used in GP training parley, but which helps explain the educational lens GPSA takes with our supports for supervisors. These scenarios are simulation aids. More importantly, they aid simulation that is not AI-driven, but directed intentionally to human interaction. No answers provided, just reasoning, role play, and the teasing out of ideas between the learner and their educator or supervisor. Recognising that today's medical students and junior doctors are tomorrow's GP supervisors, after launching Scenario and the GPSA Community Hub, we asked ourselves how we could better equip tomorrow's GPs to be more empowered so that they can make the changes needed for general practice to have a robust future. In answer to this, we want to give them their own community of practice and we want to go bigger. ScenarioEd is a companion app for Scenario, dovetailing into the Scenario content so that the teacher supervisor allocates a scenario and prompt for the learner to formulate and record their response. And this requires the student to have access to the teacher ID and the scenario number. This brings up the scenario in the learner's app and gives them the ability to add their response as part of a wider discussion. In this capacity, ScenarioEd becomes a gateway to multi-jurisdictional discussions between learners, including lifelong learners, around specific patient presentations and consultation scenarios. And keeping the comments patient-centred simulates the discussions that take place between doctors in team-based care. By giving the learner access to comments made by people from across the world, they can embark on their career knowing they are part of something bigger, a global community. Developing these mobile apps has been an iterative and at times torturous undertaking, especially given financial restraints as a very small not-for-profit organisation. And yet we've come close to keeping to the budget that we set ourselves and established an admin panel along the way that will allow our in-house team to add and modify all content, including that for new categories developed with other colleges. In terms of next steps, we are keen to partner with local and international universities to roll out ScenarioEd as a tool for medical educators with a whole lot of features designed to aid this process, making this simulation tool something that will save a lot of time and effort for the educator at all levels of learning.